Not a contraindication, but the parathyroids, as you know, they get damaged very often on those patients. And even if you transplant them, those parathyroids, in my opinion, in my experience, they never raise to the occasion. They still need to take a good amount of calcium, even though your parathyroid hormone is normal. So the patients with Whipples and gastric bypasses, the temporary or it can be permanent, even though they have normal PTH levels. So some of these patients are crippled by that complication, even though their PTHs are totally normal. So those are definitely considerations when you decide to do the thyroidectomies for Graves. Do you surgeons agree with that?
Yeah, I typically tell people it's anybody who I think is going to have a calcium absorption problem, the risks of hypoparathyroidism are inordinately higher and much more severe. So I tend to look at it's not exclusively if they've had a bypass, it's how successful was this bypass? Are they on calcium supplements now? Do they already have some secondary hyperparathyroidism? Those are patients that surgery is much higher risk, and you know the consequence of something like hypoparathyroidism is much more severe, up to the point that it could be lethal. So we just want to make sure that we're not putting them at undue risk.